This video demonstrates how to use the CELON method in children to reduce the volume of hypertrophic tonsils by about 30 to 40%. The use of intubation anesthesia is recommended. In older children, you can also use a laryngeal mask to administer anesthesia. Perioperative antibiotic prophylaxis, for example cephalosporin, is rarely necessary. The power setting on your control unit determines the extent of coagulation induction. The lower the power setting, the longer the application time and the greater extent of coagulation area. Here, a setting of 7 watts is recommended to make lesions in large palatine tonsils. Insert the applicator into the tonsils until the insulating tube of the probe touches the tissue. Take care not to penetrate the underlying tonsil capsule. Also, avoid the immediate area of the tonsil bed by pulling the tonsils away from the critical structures and toward the median plane. After positioning the probe, activate the power supply by pressing the foot switch. You can monitor the status of coagulation via the acoustic signal. The power supply is reduced automatically to prevent overdose effects. The points of insertion should be approximately 1 centimeter apart. The number of insertions required depends on the size of the tonsils. 4 to 6 punctures are normally necessary. A little blanching may occur, but this is normal and not a reason to stop the coagulation. Due to the soft lymphatic tissue of children, the application takes up to 10 seconds for each lesion. It might be necessary to clean the tip between coagulations. The total procedure takes about 15 minutes. Bleeding is rare and in most cases soon stops on its own. If necessary, you can usually also perform an adenotomy during the same treatment session with no additional risks. Because of the risk of swelling, the child should be kept under postoperative observation for at least a couple of hours after the procedure. Treatment with the CELON method can be repeated 6 weeks later if required. For postoperative pain treatment, ibuprofen or paracetamol are recommended for children, and diclofenac is recommended for adults. This procedure should not be performed on children under 3. If your patient has chronically recurrent tonsillitis, therapeutic treatment is not recommended. This procedure should also not be used to treat kissing tonsils in small children due to the risk of postoperative swelling. Olympus wishes you much success using the CELON method. For further information, please see the procedure guides or visit our website.